first step in the editing process is to turn on track changes for the Word document. This way the author can see all of the changes made to his or her document, and it's much easier in the review process. An author should be able to see everything the editor changed, and that helps to accept or reject the changes later, or perhaps follow suggestions in revision. The first step we take at Wallace: provide a greeting. Want to let the author know our name and what we have done. It's professional and it adds some clarity to the process. And here I have a prepared comment, and as you can see, greeting the author and letting them know they requested a particular journal in this instance. I want to make sure that their target audience is explicitly mentioned, and what I have done, and that I do wish them luck. We all do, and we want everybody to succeed here. It's important to remind the author that that is the whole purpose here. Moving on to the editing itself, I take a look at the title. Often I will highlight the title to remind myself later to review it, because it's best generally to review the title at the end of editing to make sure that it does fit the paper, because I'm just seeing this paper for the first time ostensibly, and I may not, even though the title is well written, grammatically appropriate and clear, it might not actually fit the paper ideally. So I will come back to it at the very end. In this instance, though, for this demonstration, I am editing only the introduction. So the paper, I've gone through this paper already, and the title does fit, so I can move on from there. Moving on to the paper itself, the introduction heading appears fine. It's the same font and size as the title, but some styles and journals do require that, or they don't make any specific recommendations regarding that. So it's not a large concern in editing. So I can move forward with the text itself. And I have this phrase, infection with the hepatitis C virus. This is grammatically appropriate and clear, but we can clean it up and make it more concise. Okay, I will make my revision and explain it afterward. Okay, and I want to make sure I preserve infection, hepatitis C virus, infection. I made this change because infection with the hepatitis C virus, it's grammatically appropriate and clear, but it's rather wordy. I can make this change more concise, make it shorter. That is a hallmark of technical writing and various other domains that are not so technical, but of academic writing as well. If you can say something with as few words as possible, with as short as phrases as possible, it's usually best. You want your reader to be able to move along quickly and crisply without laboring over your words and constructions. So even though it's counter to what we're taught in the early days of English writing, the early years, we often are taught more is more, but less is more is actually more appropriate. We want to aim for conciseness. Now, the author very likely worked hard on getting this initial phrase right, this opening sentence. They want to make sure it was appropriate, but here I went and changed it. So I want to explain why I did that. So I'm going to provide a comment, and this comment also is designed to help the reader, the author, understand why I've made many of the other subsequent changes that are similar. And I have a prepared comment that I'll place here. And please strive for conciseness where possible in medical writing. Now, I do have where possible. Conciseness is not always the most important aspect of a construction or a sentence. We don't want to sacrifice clarity. We also don't want to make a clause or phrase more concise and in the process make it wordier. For instance, here we have hepatitis C virus infection. We have turned hepatitis C virus, this entire phrase, into an adjective modifying infection. If we have too many nouns modifying the object noun, then it can become quite a mouthful for the reader, and it can become confusing, and it defeats the purpose of making the writing more concise. We're aiming for clarity here. In this instance, though, it seems rather harmless to revise it to hepatitis C virus infection. The author has appropriately introduced the abbreviation, so I move on there. The rest of this clause usually leads to chronic hepatitis. Again, this is grammatically appropriate. Usually, it's not a bad word, but it is somewhat ambiguous. A journal is not likely to reject a paper if it's being used, but it will mention it. It could be grounds for rejection if the usage or multiple uses are ambiguous. Usually can be ambiguous, and I'm going to provide my comment to explain this. I'll go ahead and change it and then explain. I'm going to use typically. Usually is an ambiguous adverb that can indicate either frequency or prevalence. Now, in some contexts, frequency and prevalence can be synonymous, mean the same thing. However, here I'm indicating that frequency, how often something occurs. Prevalence, how much it is found. For instance, the number of objects or instances. In this instance, hepatitis C virus typically leads. Typically meaning with most patients under most circumstances. I don't want to make this change without explaining to the author why I did it. And it's also likely that the author used usually again. And to maintain consistency, I want to make sure that I catch all usages in the paper. Okay, so I've got usually here, and I'm going to take a look at each usage the author has. Okay, it turns out that's the only one. And I can move on from there. Okay. Moving forward with this sentence, leads to chronic hepatitis, often follows a progressive course over many years, and can finally result in cirrhosis. I'm going to move back. I think a conjunction here would work. It clarifies it somewhat. The author has multiple clauses here, and omitting conjunctions can often lead to confusing wording, I should say, or ambiguous, and we don't want that. Sometimes it can be just downright inappropriate. Okay, often follows a progressive course over many years. Okay, and can finally result. Okay, this isn't bad, but we can do without it. Okay. I'll make sure we put the appropriate punctuation. I'll place a comma here to end that clause, and then I have finally result. The revision now, I got rid of and can. I deleted that. I'm going to have to change this finally resulting in. But before I move forward, I have a problem with finally. Final result is one of the classic redundant phrases in formal writing. Redundant phrases such as time period, close proximity, general public, phrases where one word is not necessary. In this instance, a result is final. We don't need the finally resulting. But I have another problem with finally. It connotes something that it's the end, and in this statement, finally resulting in cirrhosis and a carcinoma and liver transplantation. This is maybe the end of hepatitis C infection, but it's not the end for the patient. And I have a problem with using finally. I think ultimately would fit better there. And I'm going to explain this to the author briefly. I don't want to explain too much, give the author a lot to read, but the author deserves an explanation. And I could move forward and explain more about ultimately, but I think in this instance, ultimately would be more appropriate. It's rather synonymous with finally, but again, finally connotes the very end, the end of it all. Maybe, I know a phrase ultimately resulting in death could be appropriate, but in that instance, I'd rather use finally because ultimate can be the end of a particular part of a process, where finally is right at the very end of it all. Okay. Okay. The rest of this looks fine. Okay. I'm going to move forward. The goals for antiviral treatment. Okay. This is, again, not bad, but goal is rather vague in a medical context. Usually they use purpose or objective. Okay. And the author pluralized this. A little typo there. Got to make sure we don't let that go. Antiviral treatment is to achieve. See here, the author had the goals for this is. Well, that's inappropriate. This would have to be are. Now, would that be appropriate with what follows? To achieve sustained eradication of HCV, which is defined as, yes, the author really lists only one goal, one objective. So, turns out the verb is appropriate, the plural usage is not. This is a common error in formal writing. We want to make sure that the subject of the sentence agrees with its verb and vice versa. Okay, so I have here, I've got the objective for and is, they agree. Okay, and then just to double check, we've got to achieve sustained eradication of HCV. Okay, this is 1, 1, 1. It's critical in editing to make sure everything matches, everything fits. Okay, the objective. Now, goal, there's a good chance the author used that again. In the editing process, to keep a flow, editing is much like writing. I will often highlight this so that I can come back to it later. What I want to do when I come back to it is make sure that every usage of goal is changed to objective. Okay. I'm going to go ahead and do that now, though. This is something we do in editing to make sure that the usage is consistent. Okay. And sometimes it could be a lot quicker to just copy and paste, but I just typed it there for. Okay. So 2 sentences later, another goal. I'll go ahead and change that. Objective. Word has let me know that's the end of that usage in the paper. Good to know. Okay. So I'm back to this. The objective for. Generally, a preposition would be of. The objective of antiviral treatment of chronic HCV. For indicates purpose, but that would be a different purpose here. Of indicates possession. It's an objective involved in this treatment. I would use for if I were using the verb, the objective for treating chronic HCV, something like that. But with the noun, I think the preposition of fits more clearly. However, if one were to leave for antiviral treatment of, probably wouldn't be a problem. I don't often say that. Prepositions are critical. They're small, powerful words. Choosing the most appropriate one is critical to most instances of expressing meaning accurately. Okay, antiviral treatment of chronic HCV is to achieve sustained eradication. Okay, okay, and which is defined as, now this which, I'm a little bothered by this because achieve sustained eradication. Eradication is what which is referring to. And then we have of HCV. But I think the meaning is rather clear. Usually which refers to whatever is immediately placed before the comma. I'm going to come back to this notion in a moment with another usage subsequently. Okay, I actually think this clause is fine. Okay, now I'm back here. Another objective is to stop or delay the progression to cirrhosis, decompensated liver disease, or HCC. Very clear. Okay. Statins, if I'm pronouncing that correctly. And then this mouthful of terms looks fine to me. Okay. We've got a plural noun, are used, fine. They're used to manage, okay, and prevent coronary heart disease. Not bad, but we want to get specific as possible. English has a wide vocabulary, the widest in the world, and there are many words that are specific to usage, to particular meanings. And manage is not bad, but we want something that's more domain specific. We're talking about treatment. I'm going to change that to treat. Okay, and I'd like to comment on that so that the author understands. Sometimes during the editing process, particularly during commenting, I'll realize that I forgot to comment on something else. Now, what I could do in such instances is make some sort of highlight note to myself. And I was taking a look here, and that reminded me of this clause, which is defined as the persistent absence of HCV RNA in serum 6 months or after finishing treatment. Yeah. Sometimes we do go back, and I'm going to go back. 6 months or more, not bad, but we're talking about a certain time point and moving on in the future. They mean arguably the same thing, but I think I'm going to change this to 4 at least. Could be for a minimum of. I think I want to get rid of it one more. Yeah, this was the problem I had. Sometimes problems, they sit in the back of the mind and you don't catch it right away, but what's critical is that you catch it before you're finished. After finishing treatment, I don't like this. Okay, which is defined as the persistent absence of HCV RNA in serum for at least 6 months after finishing treatment. Well, what is finishing? Okay, it's implied that the medical technician, the physician, the nurse, the healthcare provider, I think in this instance it would be a physician, but after finishing treatment, could even be a patient in some contexts. The point is, what finishing is attributed to is rather unclear. I don't like this. I'm going to get rid of the verb and change it to completion. And I did look at this earlier, and just want to make sure that I do catch it here. I've got a comment prepared. Definitely want to let the author know about this. It's a rather long comment, but I want the author to be clear. Okay, although I normally recommend favoring the verb form of a word over its noun counterpart, that's common in formal writing. You do want verbs more than wordy noun phrases, but not always. In this instance, I suggest using the noun completion to ensure that sustained eradication of HCV is not interpreted as having engaged in the act of finishing treatment. This is a common error in formal English, but it's also a frequent reason for an academic journal to reject a paper. This is similar to a dangling modifier or a misplaced antecedent. The point is, we have a verb that is not attributed to the appropriate actor. Okay, we don't want this eradication, or in this instance, the sustained eradication. We don't want that to be engaging in any acts of beginning treatment, engaging in treatment, finishing treatment. Using the noun form gets rid of that ambiguity, mitigates it. Okay. All right, and I think while I'm at it, the author deserves a comment about changing objective. Okay. Now, this comment, actually, pretty much all these comments, I don't want to bombard the author with comments. I don't want to give the author too much work to do. Some people enjoy having a copious reference from the editor. Others are not concerned about it or find the comments to be maybe a little tedious. We want to err on the side of caution, though, and explain ourselves, and where we can, educate the author so that they can improve as writers, just as we're trying to do as editors. But I don't want to repeat myself unnecessarily for many reasons, and primarily just so that the finished product is not difficult for the author to deal with. Okay. All right. I have this: treat and prevent coronary heart disease and stroke in patient with hyperlipidemia. Okay, this is a problem. Patient is a countable noun. We need an article, either the patient or a patient, but in this instance, they're being general. We're going to refer to patients. Okay. All right. Next sentence. Recently, statins have been investigated. Okay. Recently, this is a problem. We don't know the time frame here. Okay. Recently can be quite general. I'll paste my comment, which will explain this concern, this multifaceted concern. Okay. As you can see here, we need the author to be more specific. Recently is a vague modifier when the involved time span is unknown. And this statement is not supported by a citation reference, which would indicate the relevant time. If an author uses recently in a statement, but the statement is supported by citation references, particularly those that include the year in text, I usually don't comment about it, as long as the years involved are relatively recent. But in this instance, the author does not have a citation reference. There are no years mentioned, no reference to time at all. So I want to leave this comment. This is also another concern about it is, in addition, please remember that your paper might be researched many years from now, and the investigations you report may not be recent then. Okay. This is something we commonly see in editing. Okay. Okay, statins have been investigated for their anti-proliferative, anti-angiogenic, anti-inflammatory. I see some inconsistency here. Got anti-neoplastic. Inconsistency is a common obstacle we see in editing. We want to make sure that usage is consistent. Okay. The author has not used a hyphen for anti-proliferative. Anti is a prefix. It is not a standalone word. Okay, this seems rather appropriate. Same here. Now, here, the hyphen may be here because we have, if we get rid of it, and I'll show you this in the final version, it's a rather ugly, cumbersome looking construction. We have two consecutive I's. English has very few words that do this, that don't involve these prefixes or suffixes. The words that leap to mind when you use ski or taxi as a verb, skiing, taxiing. But it's very rare in English, and it looks almost wrong. But it's not in this instance. Now, this paper, double checking, is being edited according to the Journal of Hepatology. One of our style guides that we follow is the American Medical Association. They do recommend avoiding such constructions. Okay, we don't want meta-analysis where you get two consecutive A's or like this, anti-inflammatory. But this is not an AMA paper, so to be consistent and to be thorough, I'm going to go ahead and delete it because some styles are fine with it. If you search anti-inflammatory online in a journal database, or maybe even just on something more easily accessible such as Google Scholar, you'll find thousands of usages for it. You'll find a lot with hyphens too, but it really depends on what your target audience wants. Okay. I'm going to go ahead and get rid of it though, because that is our standard house style if we don't have a style guide or journal telling us otherwise. Okay. But I'm definitely going to explain this to the author. If I don't explain it, the author could be somewhat frustrated, and maybe just, if they're not frustrated, they just won't agree and will reject my change without understanding why. And in some instances, this one maybe not so much, but in other instances, this could be a problem for them. Okay, so I've got this comment explaining myself, everything I just did state. Okay, now we also have this anti-neoplastic. That's just inconsistent. There's no problem regarding consecutive eyes. The author's just being inconsistent. Going to get rid of that. Okay, and I notice here we have a list. We have 1, 2, 3, and then 4, but, and then separated by the conjunction and. Going to place a serial comma there. This is often viewed as a primarily American convention for formal writing, but we do apply it here at Wallace in the British convention. If we're editing a paper according to British English, we'll do that too for clarity. Sometimes an author will request that we avoid using the serial comma, also called the Oxford comma. We don't recommend it though. It can often result in ambiguous wording. This is a common convention to avoid using it. I had some friends and colleagues when I was in college who were journalism majors, and that was what they were taught. And of course in journalism, usually they need to be economical with print, so they will not use unnecessary commas, or at least commas they deem unnecessary. In formal academic writing though, it's best to be clear. Don't sacrifice conciseness for clarity. Okay, moving on there. I'm fine with that. Okay, in addition, some animal studies show, okay. Depending on the style, one might want to use previous research, use the present tense in describing it. However, unless we are informed otherwise by the author or the target audience, we generally follow a convention that uses the past tense or the present perfect tense to refer to previous research. Okay. It's a simple comment, but it will also explain some of the changes I make later. Present perfect tense. When it's a single previous study, we'll use the simple past tense. In this instance, that would be showed. Okay. The rest of this looks fine. Sometimes we might change this to, however. Let you take a look at that. It's not a necessary change, but the word however is frequently used in abstracts and introductions to establish a knowledge gap. Okay, however, clinical studies are limited. Okay. In this instance, I don't think it's necessary. I might sometimes provide a comment as a suggestion to the author that they could use it. But here I think the author has decent flow. Using the semicolon and however does disrupt the flow. It depends. I think actually in this instance I would provide the comment, but I think you get the point. I'll move forward. Limited is a bit of a problem. I often leave a comment here to ask the author, do you mean scope? My comments are generally a little longer than this, and I don't always like to have a direct question to the author because I don't want to seem like I'm challenging him or her. But the point is, limited is a little ambiguous here. Okay. I might come back to that and reword it, but I want to make sure that the author considers that potential ambiguity. Okay, previous study from. This is problematic already because study can be non-countable, but in this instance it's clearly countable. Okay, I'm thinking with study, taking a look at the rest of it, I think they do mean a previous study rather than previous studies. Okay, from the hepatitis C trial cohort, I'm going to use of here. Okay, this looks fine. I want to get rid of this. Okay, this trial cohort indicated that statin use can reduce the risk of fibrosis progression in patients with chronic hepatitis C infection and advanced hepatic fibrosis who had. If we have the comma here, this is almost like what I was talking about earlier with which. If we have the comma here, it basically indicates that whatever immediately precedes the comma is what who is referring to, and that is certainly not the case. Who are the patients? That's who they are. It's not the infection or the fibrosis. I'm going to comment on this. Giving the author a bit much to read, but the revision process is critical. I do recommend that authors go through a revision process after using our services. It is his or her paper after all. Please be careful when using the relative pronoun who, which is syntactically connected. It's a big word, I can get rid of that, to the word or phrase that immediately precedes the comma in the previous clause. In this instance, using a comma attributes who to the fibrosis and or infection. We don't want that. We want it to be attributed to the patients. You saw that I deleted syntactically there. That's a big word that not too many native speakers use, and here I am giving it to the author who is not a native English speaker. Sometimes we do use some big words. One school of thought is to avoid doing that because the author's English is not at a native level, and some of these words might be difficult for them. That's a very good point. However, there are online dictionaries and translation applications such as Google Translate. The author could put that in and get the main idea of what we're stating. And sometimes you want to use the highly technical multi-syllabic words so that the author knows specifically what we're referring to. They can also perform a search. If they took our phrase and searched it online, they might find some information that would help them with this particular construction. But I think in this instance, syntactically is unnecessary. Okay. I think I'm fine with that. Take a look at the rest of it. One problem I have, though, going back a little bit, some animal studies. Next sentence, a previous study. This author has no citation references. Now, when the paper's finished, it must have them. This author probably intends to put them in afterward. Some authors do prefer to do that. However, it's just not good for us. We cannot, in good conscience, overlook it. We must remind the author, so to speak. So, generally here, I have this, and some animal studies have. Okay, I'm going to give the author a comment to remind him or her about this. Now, I have a standard comment I use. It's perhaps a bit strong, but I want the author to understand the gravity of the situation. I strongly recommend that you provide a citation reference to support this statement. I could reword this. Please remember to. Yeah, I think that's a little better. Makes the same point. Okay. There are instances, though, where the author does have citation references, and they just seem to slip in a statement that really seems to need one, and maybe they don't realize it. And that's when I tend to use the I strongly recommend. I don't think that's necessary here. I think the author clearly omitted them for later insertion. Okay, but I'm also concerned about this statement, a previous study. This one directly refers to a study, so I'm going to, another reminder, and I'm going to specify why. Okay, again, please support this statement. Now, I like to use the word again. I don't want the author to think that I'm not paying attention to what I'm doing or that I'm insulting his or her intelligence. I want my comments to have a connection to, I want them to reflect the fact that I am paying attention and that I do know what I have stated previously. The final sentence here, doing so is particularly necessary here because this statement directly refers to a previous study. Again, I believe the author already knows this, but just want to be thorough and as helpful as possible. Okay. Okay, in contrast, data regarding, it's not bad, but I don't really see why this is necessary. Sometimes I might just leave a comment stating, please consider omitting this. The reason for this phrase is unclear. However, I'm pretty sure it's unnecessary. If I am wrong, the author, it's always his or her prerogative to reject the change. Okay. Data regarding the anti-fibrogenic. Okay, this anti is fine. We're nice and consistent there. Actions of statins for those patients with this those is unnecessary. It's a common usage that is just unnecessary. Those would be fine if we already know what it's referring to. For patients with this infection, and maybe if they were referring to other patients and those with, then it would be fine, but here it's unnecessary. Okay, with chronic hepatitis C infection, and has not progressed. Okay, I think this means that has not. Typing is not my best skill, but catching my own errors is one of my best. Okay, that has not yet progressed. We could also say that has yet to progress, but I think this is fine. To cirrhosis is limited. Okay. Data in most academic contexts is plural. The singular use is datum. Okay, data regarding this for patients with this infection that has not yet progressed to cirrhosis, yet are. Okay, yeah, this yet is not necessary, obviously. I don't like burying this passive voice construction way at the end of the sentence. It's appropriate, but it's hard on the reader. It forces many readers, including me, to go back and read the sentence again. And we want to do that as little as possible. So, again, we have that ambiguous use of limited, but I've already mentioned that to the author. If I can, and in this instance I can, I do want to put the verb construction as early as possible. Okay, English is not German. Sometimes you have a nice sentence where there's strong punch and emphasis when you finish it with a verb, but we don't want to do that if we don't have to. And in this instance, particularly because the passive voice is used, it's really difficult, cumbersome for the reader to handle a sentence like that without, we want to know exactly what is going on with the data. Data are limited regarding this and that. Okay, take a look at our final sentence to make sure. I've made a lot of changes to the sentence. I want to make sure, and I usually go back and check in the final version here. Data are limited. Okay, it's a rather cumbersome sentence, but it is appropriate. In another instance, I might offer some recommendations. I might even reword it myself, but here I'll move forward. Okay, here we have the final sentence of the introduction. The purpose of the study was to investigate the association between use of statin. Use is a countable noun. Okay. Actually, we can use non-countably, but here generally we'd have the use of statin, but I think I'm going to go ahead and, yeah, it can be used non-countably in this instance. Between statin use and risk. Risk is another term that can be used both countably and non-countably, but I think that's clearer here. Using the definite article isn't necessarily indicating that it's countable, but we've got risk of cirrhosis. We're indicating a specific risk, and this reflects native usage even at the formal level. Okay, so we have association between statin use and the risk of cirrhosis. Now I could have this as between the use of statin and statin is countable, so I have to say statins. Between the use of statins and the risk of. Not really a problem, but what I had before was more concise. Between statin use and the risk of cirrhosis development. Okay. Now here, statin is used as an adjective, so I do not need the plural marker. Okay, in patient with. Okay, patient must be plural in this context. With hepatitis C infection. Okay. These changes speak for themselves, but here, this is minor, but I usually like to let the author know. One concern regarding medical writing. Okay. Medical writing audiences typically require a paper to explicitly state the research objective. However, I want the author to consider making it more concise because the purpose is clearly implied. Consider using this study investigated. With domains other than medicine, we editors typically revise it for conciseness. Sometimes the statement will say the aim of this study or this study attempted to, and it's something like investigate or explore. And those verbs just don't fit with an attempt or an aim. You just do them, regardless of whether the results are favorable or successful. Okay, I think I'm a little concerned about okay. I made a lot of changes to this sentence, and I want the author to understand why I did so, at least in a general sense. Okay, so I've restructured it. As I stated, I moved the verb phrase to enhance clarity and improve readability. Please review my changes and ensure that I preserved your intended meaning. This is critical. I mentioned this, of course, in the greeting, but it's good to mention it again for specific instances. And that is typically how I would edit an introduction. Now, generally, when I reach the end of the paper, I will go over this briefly again to make sure I didn't miss anything, which often involves reviewing it in the final version. I check what word has dinged as misspellings. I see I have a spacing error there. I might double check these online and then add them to my dictionary if they're fine, or ignore them. But that's basically how an introduction is edited.